Hello, this is Dr. Bob Johnson, and I am just so pleased to have a wonderful person on this call. Her name is Kate Rayom, and she's got a Bachelor of Science, and she's a naturopath, but more importantly, she has done a huge amount of research and has written a wonderful book that I've recently finished, and I thought I have to get her on for my audience. The book's name is Vitamin K2 and the Calcium Paradox. Dr. Kate is a naturopathic doctor, and as I said, she's an author from Montreal, Quebec. Kate's personal experiences with illness really directed her path toward nutrition and natural healing, which I know that's the case with many people. She got her professional degree at the Canadian College of Naturopathic Medicine in Toronto, where she did a residency, and she's got positions both in academic and clinical faculties, which is very impressive. She's a sought-after international speaker and a popular guest on many media, so we're very lucky to have her. And as I said, her book, Vitamin K2 and the Calcium Paradox, How a Little-Known Vitamin Could Save Your Life, has garnered global attention and acclaim for its enlightening view, as it did mine, about this overlooked nutrient. So without further ado, I would like to introduce Kate Rayom. Hello.
Thank you so much. Good to be here.
I am so glad to have you, and our audience is going to have such a treat in getting your information and being enlightened by your research. Anything that I missed there on your background before we get into the gist of this interview?
No, I think that covers the basics and how I ended coming to be in the place I am now.
Well, tell us, I think so many people are very confused about calcium because years ago everybody said, well, you got to take calcium for your bones. But apparently calcium by itself is very harmful. So tell us a little bit about the whole mineral of calcium and that kind of thing. Calcium
is a double-edged sword. It is one, and by that I mean, and this is what I refer to as the calcium paradox in my book, is we need calcium in our bodies, but we need it to be in the right places. Specifically, of course, we want it to be in our bones and our teeth. But if it ends up in other places, then it can be dangerous and even deadly. And some of those other places, more benign ones may be joint tissue calcification. There can be breast tissue calcification, but more seriously, arterial calcifications, which can lead to heart attack and stroke. And so we have this problem with calcium, and we need calcium all the time in relatively high amounts in our body. We need it for our heart to beat, for our nerves to function, for our muscles to contract. And so we've always needed a way to protect ourselves against the calcium depositing where it shouldn't. And that system can go awry.
So tell us a little bit about how does that system go awry, meaning we need calcium and yet it should only go in a couple of places. Tell us a little bit more how we can guide it to where it needs to go.
Mm-hmm. Exactly. So the body does have this system to make sure calcium goes to the right places and doesn't end up in the wrong places because, as I said, we always have high levels of calcium, and so we need to get this right. But this system of putting calcium in its place depends largely on a nutrient, and that is vitamin K2. And the downside of this is that it's possible to become deficient in vitamin K2. When that happens, calcium will start to be leached from areas where we want it to be, for example, our bones, and it will end up building up in other areas where we don't want it to be, and we get this real problem then with calcium. And so vitamin K2, the good news about this is if you do have it in the right amounts, it can set that straight and direct calcium to the right places and even remove it from where it's not supposed to be.
So you're saying that we need to be sufficiently up on our vitamin K2 to be able to make sure that calcium goes in the right place.
Exactly right. Now, there's a couple of nutrients that participate in this process, but ultimately, if you're missing the K2, which many people are, then your calcium is not going to be getting into the right places, and it will start building up in the wrong places.
How does one get vitamin K2 at the levels that we need to have calcium be helpful?
Well, this is a little bit tricky because the main sources of vitamin K2 in our diets and our access to those have changed a lot over the years, over the past several decades. So there's two main sources of vitamin K2. One is from animal foods, and it's a fat-soluble vitamin, so the fat of things like butter and egg yolks, but much more so when those animals are out on pasture eating green grass. So sometimes this is called the grass-fed vitamin because it's present in quite high amounts in the fat of animals who are eating grass, but not very much at all in grain-fed animals. And when we removed animals from the pasture and confined them to grain feeding, which is the most common practice, our vitamin K2 intake really took a hit. So, you'd have to eat about a dozen of your average grocery store eggs per day to get a worthwhile amount of vitamin K2 from those yolks, and that's just not feasible. Now, the grass-fed eggs are a great source of vitamin K2 at the right time of the year. Just 2 of those would do you very well, but those are very hard to come by. The other source of vitamin K2 in our diets is certain types of fermented foods. So some, but not all, bacteria will make vitamin K2. So some types of fermented foods, certain types of cheeses, for example, are very high in vitamin K2. And again, we don't eat as much fermented foods as we once did. The refrigerator, for example, hasn't been our friend in this department. That's how we keep our food preserved now versus lactofermentation, which is what we used to do. And so it's not as easy to come, and as well in our culture in North America, we don't consume as many fermented foods, so we don't get as much vitamin K2 from that source. So deficiency is widespread because we don't have a lot of K2 coming in through our diets.
And do you think this lack of K2 and ultimately putting the calcium into the wrong tissues, I know that it goes into arteries and the heart muscle and so forth, is this, as you can see, a huge source of our cardiovascular disease?
Very much so. This is absolutely at the root, a key factor at the root of cardiovascular disease. Of course, we know that lack of magnesium is important and actually plays a role with K2. We know that inflammation is important and stress, but the fact that the K2 is lacking means that calcium will simply build up. And we know, for example, that calcification of the arteries is an excellent predictor of your risk of having a heart attack versus measuring cholesterol, for example, is not a good predictor at all of your risk of heart attack.
I think that's a huge misunderstanding, is that everybody looks at cholesterol because it's a nice number that they love to see. But again, I know that the whole idea and the whole research behind cholesterol is really missing so many important ideas.
Yep. So 50% of people who have heart attacks have normal cholesterol levels at the time of their heart attack. There's so much wrong in terms of cholesterol that can lead us astray with cholesterol and heart disease, whereas looking at calcium, for example, it's considered to be not quite a crystal ball, but still a really good predictor of your risk of having heart attacks by looking at the amount of calcium in your coronary arteries.
Going back to the sources of K2, when I read your book, I saw that the greatest source by far and away was natto, which I had to do a little research on, and when I did finally get some, it wasn't the most palatable thing to eat. But tell us a little bit about that.
I'm impressed that you went to find some and tried it. It is considered to be the highest known food in vitamin K2. This is a fermented soybean food that's eaten as a breakfast food in some areas of Japan. And it is an acquired taste and texture. It's unique, let's say that. And I struggle with it, but I do encourage people to try it because some people surprisingly like it right off the bat. Some people get to craving it. And it happens to be very high in vitamin K2. And in areas where they eat this, they've done studies in Japan. People have better bone density, better heart health, even it seems better cognitive function. So it seems to be associated with lots of health benefits.
Is supplementation with K2, I guess in combination with D3, is that a good source or not a great source of K2?
No, it is a good source. If you can't find those K2-rich foods and are able to consume them on pretty much a daily basis, then a supplement is a great insurance. It's a great backup to making sure you're getting that K2 in regularly.
And does it necessarily have to be combined with D3, or can it be K2 alone?
It can be K2 on its own, and most of the research and studies done on K2 do look at it being taken alone. However, K2 and D3 really do work well together. For example, vitamin D will help you absorb calcium. Vitamin K2 puts it into place and takes it out of where it shouldn't be. It protects you against the downsides of vitamin D, which is excess calcification. So there's lots of good reasons to take them together.
Right. Let's go back to some of the conditions caused by K2 deficiency and misuse by the body of calcium. I know in the book you talked a little bit about it being a big contributor to osteoporosis, but talk to about that as well as other conditions that come from a K2 deficiency.
Mm-hmm. Well, looking at it in terms of, where calcium should be in the body and it's not, definitely osteoporosis is the leader here, and it's such a common condition in North America, and it's a big health problem. And when we see this osteoporosis and the bones are lacking in calcium, we think, oh, well, the bones are lacking in calcium, well, take more calcium and take more and more and more calcium. And if that was true, in other words, if by just giving enough calcium you could cure osteoporosis, then we wouldn't have such a problem, but we know it doesn't work that way. So it's a matter of looking at the bones and asking, why doesn't the calcium go there and why doesn't it stay there? Now, there are a few factors in that, but K2 is definitely a very important one. Another area where the calcium should be that can be lacking is in our teeth, dental cavities in particular, and there has been a little bit of research done on that. One area where I find people will report, once they start taking K2, report benefits is that their teeth are no longer sensitive. Tooth sensitivity often goes away, as well as the plaque around their teeth tends to improve. And so oral health and oral hygiene is one aspect of the benefits of vitamin K2 that pertain to putting the calcium where it is supposed to be and making sure it's not building up.
What other conditions, other than the osteoporosis and the dental conditions, might one see as a result of K2 deficiency?
As a result of K2 deficiency, you will probably see, again, well, this isn't something you necessarily can literally see from outside the body, but calcifications building up almost anywhere in the body. And again, heel spurs, kidney stones, arterial calcification, even stiffness of the arteries we've seen can be reversed. New clinical studies out with vitamin K2, so any kind of inappropriate calcification. We also see now there's more research around, and I touched on this in my book, but there have been a few more studies about the benefits of vitamin K2 for prostate health, lowering PSA and helping with BPH or prosthetic, like growth of the prostate, for example. Veins is another place where people will notice and see this can be associated with a vitamin K2 deficiency, and a lot of people report their varicose veins clear up very nicely after taking that. So these are some areas that are sort of literally visible, and but there's also been research on children's health, helping them grow up strong and healthy. Is a very important aspect of my research, or that I dug up from the research, as well as fertility, male fertility in particular, increasing testosterone and sperm counts. There's a lot of different aspects of this.
So what you're saying, actually, if a person notices they have calcifications in abnormal areas, or they've got the cardiovascular disease, that kind of thing, then by taking a lot of K2, high levels of K2, they can actually reverse some of these things.
Oh yes, yeah. I hear this from people who email me with their results, as well as there are absolutely clinical studies, some of which I have published in my book, some of which have come out more recently, looking at, for example, reversing arterial calcifications. It's absolutely possible. Again, it sounds amazing, sounds like a miracle, but the body has this system to deal with calcium. It's always needed to do this, and it can do this if it's given the right nutrients.
Along with reversing those conditions, are there other things that a person needs to do in addition to taking the K2, like alkalinizing their body, or what would you say in addition to taking the K2?
Sure. Well, in addition to taking K2, I think it's important for any condition that this be paired with As we were saying before, vitamin D is quite helpful, and magnesium. I think that there's mounting evidence that K2 needs magnesium as well to do its job, and magnesium deficiency is common. So you will get a better result if you make sure your magnesium levels are adequate. And then beyond that, well, it depends on what condition you're looking at. For bones, yes, alkalinizing diet can be helpful. For arteries, we're looking at reducing inflammation. Things like fish oil and curcumin can really help with that. And of course, reducing stress. Depending on the condition, there can be lots of different other supportive actions that you can take.
I know in reading your book, and this I didn't know, is all the different forms of vitamin K. I know there's a K1 and there's 2 K2s. Could you just comment on that without getting too technical?
Mm-hmm. Yeah, this is important. I'm glad you brought that up. So there is vitamin K1 and K2, and one of the reasons why vitamin K2 has been overlooked for so long is because people confused it with vitamin K1. So vitamin K1 comes from green leafy vegetables, and it's very important for blood clotting, and it's just about impossible to be deficient in it. So you don't have to buy it in a supplement. You don't have to worry if you're getting enough from your diet. Your body recycles it. And vitamin K2 is quite different in that it doesn't come from green leafy vegetables. Your body doesn't recycle it, and so you can become deficient. And so this is a big difference between those. Now, even amongst vitamin K2, there are a number of forms that occur in nature. For example, the form of vitamin K2 that comes from grass-fed animal foods, for example, is different from the kind you find in fermented foods. And there's a number of different types you'll find in fermented foods. But you don't have to worrying about which type of K2 you're getting or getting some of each. It's just as long as you're getting some, the body is happy with it'll take what it can get when it comes to K2. But when you're looking at supplements on shelves, yes, you will find 2 main types of vitamin K2 supplements, something called MK4 and MK7. It's just 2 different forms of vitamin K2. They both work, they're both effective, they both have research behind them, they're both safe, but they just need to be taken in slightly different doses to get them to work. So typically the MK4 form needs a higher dose, and the MK7 form is helpful in a lower dose. So that's one of the main differences between those if you're shopping for supplements.
So people who are deficient in it and starting to take it, do they need to make sure they take the digestive enzymes with that to be able to absorb it and transport it to the proper places?
No, it's very easy to absorb, and we absorb it, yes, quite readily. It's a fat-soluble vitamin, and it goes in very easily. The only thing to be aware of is for people taking the drug warfarin, you won't get the benefit of taking vitamin K2, and it'll just don't bother, basically. For any other type of blood thinners, the non-warfarin type blood thinners, Effient, Pradaxa, Xarelto, those kinds of things, they don't interact, and so that's not a problem with those.
Certainly, taking vitamin K2 at any age is very important, but what ages and groups of people are greatly benefited the most from taking vitamin K2?
It's hard to say because, we see great benefits prenatally for fertility, so there's a group there, as well as during pregnancy, as well as for children. There's quite a bit of research on children. And then again in adolescence, we know it's a really important time that adolescents tend to be K2 deficient, and there's separate research done there. Then again around midlife, for women anyway, or a little bit later at menopause, that becomes extremely important. I would say, because we tend to be deficient in K2 throughout our lives, anytime you can start it is good. And yeah, if you're starting it later, well, then you're just helping to make up for, deficiencies that were probably there earlier on.
Why has K2, in your opinion, why has this vitamin been so overlooked, and the things like vitamin C and vitamin Bs and so forth are so focused on, while vitamin K2, which seems equally important, has been overlooked?
That's a good question. I know it was originally overlooked due to this case of mistaken identity, confusing K1 and K2, and there still is a little bit of that persists. However, with more research on K2 and more information and clarity, why it still continues to be overlooked is something of a mystery to me. And it is certainly potentially very therapeutic for a number of very widespread health conditions. And that maybe isn't good news for pharmaceutical companies, for example. Don't know how important that factor is. But I think it just needs more education and more information and awareness. Most people still just aren't aware of vitamin K2.
Can one overtake K2, meaning if you really supplement highly and you're taking the right foods, can you overdo it with K2?
It is considered to be non-toxic. It's been studied at very, very high doses. Now, that's not to say that more is better, that you will, get more results from taking higher and higher doses. I haven't seen conditions that benefit from more than, I would say 500 micrograms of the MK7 form, but it is safe, and they have studied it in very high doses.
I loved your book. I mean, I just ran through it as quickly as possible because I just couldn't get enough of the information. But who really should be reading your book?
Oh, well, and thank you for that, by the way. I appreciate that. Anybody who is taking calcium absolutely will want to read this book. Anybody who's concerned around bone health or heart health. Anybody who's taking vitamin D, I think, actually would benefit from reading my book, as well as people with, any of the other health conditions that we're talking about. There's kidney disease, various types of cancer. We haven't even gotten into that, children's health. But yeah, or anybody who's looking at just improving their general health and finding that missing piece to the puzzle of health.
Do you want to mention a little bit about cancer? Because the big C is on so many people's minds.
For sure it is. And yeah, that was some of the original research I found about vitamin K2, and I was surprised how much there was about that. And on many different types of cancer, different types of leukemia, and since the publication of the book, there's been more and more research about vitamin K2 and prostate cancer. That's a big one. Prostate health and prostate cancer, K2 is so important and has been really overlooked. But certainly it is a really important nutrient when it comes to cancer.
So you are just an incredible researcher and just a very good writer. I'm assuming you did basically all the writing of this book. But
yeah.
What other things are you searching now? Are you researching and finding out, and where you go from here?
Well, I have to say that, this book on K2 has been such a labor of love, and I still love following the research, and I think it'll be time for an update in the not-too-distant future. But there are also other topics that interest me, like the aging process itself and inflammation and how those interact. That's sort of probably what's caught my attention lately, as well as cognitive function, how we can keep our brains working as well as possible as we age.
Do you know much about the comparison? I know you're in Canada, and I know in the U.S. where we have so much epidemic of chronic health issues and things like diabetes and obesity is just out of control. And do you see a similar comparison in Canada that you have to deal with on a regular basis?
Yes, we do. We're a little bit behind you guys in terms of the numbers of, say, obesity and diabetes, but not that far behind, and it's definitely a crisis here as well.
Are you a primary care physician? I know you're a naturopath, but do you see people coming to you more frequently than they would go to, say, a primary care physician?
Well, naturopathic doctors are trained to be primary care physicians and licensed. The province I'm in, we are licensed to do that. My practice is currently on hold, so I'm not seeing patients at this time. But yes, typically when somebody comes to see a naturopathic doctor, well, unfortunately, it's often after they've been around the block and not gotten help anywhere else. But then once that happens, they will see their naturopathic doctor typically more frequently, to be more proactive about their health.
What is a contact information, if you don't mind, an email or something where people can get a hold of you or go to a website? Your information is just way too valuable to keep under wraps.
Well, my website is www.drkateND, and that's doctor spelled out the long way, Kate, and then ND is naturopathic doctor. Or if you just Google Dr. Kate, I'll probably come up, and people can reach me through there and email me through my website.
Is there anything else you'd like to bring up that we haven't discussed?
Oh, yes. One last thing that I didn't write about in my book, but that I've heard a lot about that since, is vitamin K2 and psoriasis. It's incredible. I've heard some amazing stories. One woman has, in fact, it was so life-changing for her, she's created a whole website about her experience called www.freedomfrompsoriasis.com, and she's not selling anything. She's just talking about her experience with psoriasis. And so for people who are struggling with that, K2 seems to be very, very helpful.
Now, that is oral consumption. Is there anything you can use K2 topically on these lesions?
In this instance, no. You'd take the K2 internally, but then you'd in fact use magnesium topically. And between those two, it seems to make an amazing difference in skin.
And K2 internally. Very good. Anything else that you'd like to bring across? Because this is just such useful information.
Well, I could probably talk about vitamin K2 all day if you let me, but I think those cover the basic points and the basic information that people need to know.
Excellent. Well, I am just so thankful that you consented to talk to us, and this is going to go out to a lot of people, and I'm sure it's going to change a lot of people's lives. So I want to thank you very much, Kate, and it was just such a pleasure chatting with you, and I hope that you and I can keep in touch in the near future.
Thank you. I hope so too.
Take care. Bye-bye.
Bye.